Has someone you love started showing subtle yet concerning changes over the past year? Many assume that death in old age happens suddenly, but in reality, the body often gives quiet warnings months or even a year before reaching its final stage. The challenge is that these signs are easy to overlook because they start off small. It's only in hindsight that families recognize the clues were there all along. By then, it's too late to prepare, too late to create lasting memories. In this video, we'll discuss 5 key signs that often appear in the year leading up to an elderly person's passing. Some of these may be things you've noticed but dismissed as typical aging. Others may seem minor, yet indicate a gradual decline in the body's functions. Recognizing these signs early allows you to provide better care, cherish meaningful moments, and most importantly, ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end. These 5 signs can help you prepare both emotionally and practically. Understanding what's happening means you won't be caught off guard. Instead, you'll be able to make the most of the time you have with your loved one. Now let's begin. Number 1, significant weight loss. One of the earliest and most telling indicators that someone may be in the final year of life is unintentional weight loss. At first, it might seem minor, a belt needing an extra notch, looser clothing, or a once hearty appetite that starts to decline. Many families assume it's just part of aging, but the reality is that unexplained weight loss is rarely a positive sign. It often suggests the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. While some muscle loss is natural with aging, a rapid decline points to something more serious. The body may be struggling to digest food properly, or the person may no longer be processing protein effectively, leading to muscle wasting. This loss of strength does more than make movement difficult. It raises the risk of falls, weakens the immune system, and makes infections more dangerous. Another common cause of weight loss in the final year of life is a reduced appetite. Many elderly individuals simply stop feeling hungry. Their sense of taste diminishes, food no longer brings enjoyment, and they may start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological shift. As the body begins to slow down, it stops signaling the brain to seek food as frequently. The result? Less energy, reduced strength, and a gradual decline in overall health. Underlying medical conditions also play a significant role. Weight loss is a common symptom of chronic illnesses like cancer, heart failure, or kidney disease. Conditions that often begin progressing long before more noticeable symptoms appear. Even factors like depression or cognitive decline can contribute to reduced eating, creating a downward spiral where the body isn't receiving the fuel it needs to sustain itself. Many families attempt to address this by encouraging their loved ones to eat more, offering favorite meals, or supplementing with protein drinks. However, if the weight continues to drop despite these efforts, it's important to recognize that this isn't just about diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not be beneficial. Instead, prioritizing comfort, easy-to-eat foods, and hydration can have a greater impact on maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they are eating less, feeling weaker, or struggling to stay active, it's crucial to pay attention. This isn't merely about physical appearance. It's the body sending a message. Understanding that message now can help you prepare for what's ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Number 2, extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't improve with rest. This isn't just feeling a little tired after a long day. It's an overwhelming exhaustion that makes even simple tasks feel daunting. Getting out of bed becomes a struggle. Walking across the room requires effort, and activities that once felt routine, like cooking, dressing, or even holding a conversation, begin to feel too draining. This isn't just a natural part of aging, it's the body conserving its remaining energy. As organ function slows, the body prioritizes only the most essential functions. The heart pumps less efficiently, circulation weakens, and muscles receive less oxygen. This is why many elderly individuals in their final months experience weakness, unsteadiness, and an inability to maintain their usual level of activity. Metabolic slowdown is another key factor. The body is designed to produce and use energy, but as it nears its final phase, that energy is redirected. Rather than fueling movement, the body shifts toward preservation. This is why someone in decline may begin sleeping more, needing longer naps during the day, and finding it harder to stay awake for extended periods. Some may even experience sudden drops in energy, where they seem fine one moment but completely drained the next. Perhaps the most heartbreaking aspect of this process is the emotional toll of fatigue. Many seniors who once took pride in their independence begin feeling frustrated or even embarrassed by their limitations. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies. Not because they don't care, but because they simply lack the energy. This can create a cycle of isolation where they stop trying altogether, which only accelerates their decline. For families, witnessing a loved one transition from being active and engaged to exhausted and withdrawn can be heartbreaking. It's easy to assume they just need to push through it, but the truth is, forcing activity won't help. What's most important is recognizing their limits, allowing them to rest when needed, and ensuring their remaining days are as comfortable as possible. If you see a loved one experiencing deep, persistent fatigue that doesn't improve with rest, take it as a sign that their body is undergoing a major transition. This is the time to cherish conversations, create moments of peace, and support them without pressure or expectations. In the end, what truly matters isn't how much they can do. It's that they feel loved, understood, and at ease. If you're still watching this video and finding these insights helpful, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, consider doing so and turning on the bell notification so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. Now let's move on. Number 3, increased cognitive confusion or withdrawal. As someone nears the final stage of life, one of the most noticeable changes occurs in their thinking, communication, and interactions with others. A person who was once sharp and engaged may begin to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. They might repeat themselves, forget names, or lose track of time, even if they never previously had memory issues. These cognitive changes can emerge months or even a year before death. This isn't just ordinary forgetfulness. Like any other organ, the brain relies on a steady flow of oxygen and nutrients to function properly. But as circulation weakens and oxygen supply decreases, cognitive abilities start to decline. The person may become easily confused, struggle with decision-making, or fail to recognize people and places they've known for years. In some cases, they may experience brief moments of clarity followed by sudden confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. As the end of life approaches, many individuals lose interest in social interactions. You may notice them speaking less, engaging less, or spending long periods sitting quietly. It's not that they don't care about their loved ones. It's that their brain no longer processes emotions and social engagement in the same way. Conversations become tiring, loud environments feel overwhelming, and many seniors eventually retreat into their own world. Behavioral and mood changes are also common. Some individuals become more irritable, anxious, or easily frustrated. Others may appear unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a shift in personality. It's often the result of the brain adjusting to the body's gradual decline. As cognitive function slows, emotions become harder to express, and the person may no longer react to situations the way they once did. For family members, this stage can be particularly difficult. Watching a loved one become disconnected from reality or withdraw emotionally can feel like losing them. Before they are truly gone, it's important to remember that this isn't something they can control. Instead of trying to pull them back into conversations, the most meaningful thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, increasingly confused, or less engaged, don't overlook it. These are often early indicators that the body and mind are preparing for the final transition. This is a time for patience, cherishing quiet moments, and creating an environment that feels safe, familiar, and peaceful. Because even when words fade, love and comfort can still be deeply felt. Number 4, frequent infections and slow healing. As the body slows down, one of the most telling physical signs is a weakened immune system. You may notice that someone who rarely got sick before now seems to catch every cold, flu, or infection that goes around. What once were minor illnesses now take much longer to recover from, and even small wounds like a cut or bruise heal at a noticeably slower rate. These changes aren't random. They indicate that the body is no longer able to defend or repair itself as it once did. One of the biggest concerns is recurring infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become increasingly common as immunity weakens. Many families assume these are isolated incidents, but when infections become frequent or take a long time to resolve, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. Stronger medications, longer recovery times, or multiple rounds of treatment may be needed for infections that used to be minor. This happens because as circulation slows and organ function declines, the body simply doesn't respond to treatment as efficiently. Another commonly overlooked issue is slow healing wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could indicate poor circulation. When blood flow is compromised, oxygen and nutrients don't reach the skin and tissues effectively, significantly delaying the healing process. For those who are less mobile, pressure sores become a serious concern, potentially leading to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't present in the usual way. Instead of developing a high fever, an elderly person may simply seem more fatigued than usual, increasingly confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first sign of an infection, appearing even before physical symptoms. Recognizing these changes early can make a significant difference in ensuring they receive the comfort and care they need in their final stage of life. For families, watching a loved one go through repeated infections can be both frustrating and heartbreaking. It's natural to want to push for aggressive treatments, hoping that one more round of antibiotics or another hospital stay will make a difference. However, at a certain point, the focus often shifts from curing to comfort. Ensuring they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do far more for their well-being than medical interventions that may only prolong suffering. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, consider doing so and turning on the bell notification so you don't miss any future videos. Your support allows us to continue creating content that informs and inspires. Now let's move on. Number 5, major changes in breathing or circulation. One of the clearest signs that the body is approaching its final stage is a noticeable shift in breathing patterns and circulation. You may observe that your loved one's breathing becomes slower or shallower than before. At times, there may be pauses between breaths, or their breathing may turn irregular, alternating between rapid and slow rhythms. Some individuals develop a distinct pattern known as Cheney-Stokes respiration, characterized by cycles of deep, quick breaths, followed by periods of no breathing. These changes may begin subtly, but tend to become more pronounced and frequent over time. Another significant indicator is reduced circulation. Their hands, feet, or even their nose and ears may feel unusually cold to the touch. The skin might appear pale, bluish, or mottled, especially around the fingers and toes. This occurs because the body is redirecting blood flow to essential organs, reducing circulation to the extremities. It's a clear sign that the heart is not pumping as effectively as before. Shortness of breath can also become more apparent, even with minimal movement. Activities such as sitting up, speaking, or adjusting their position might leave them feeling winded. You may notice them breathing through their mouth more frequently or needing to pause mid-sentence to catch their breath. If they previously moved around without difficulty, but now struggle with basic tasks, it could indicate declining lung function. In some cases, fluid buildup in the lungs can further complicate breathing. This may result in persistent coughing, gurgling sounds, or a sensation of tightness in the chest. While it might resemble congestion from a cold, in elderly individuals nearing the end of life, it often signals weakening lungs. Lying flat may become uncomfortable, leading them to prefer sleeping propped up with pillows or in a recliner to ease their breathing. For families, witnessing these changes can be distressing. It's natural to want to help, perhaps by encouraging deeper breaths or feeling alarmed by the sudden shifts. However, in many cases, these changes are simply the body's way of gradually slowing down. While they may not be reversible, there are ways to ensure comfort. Keeping the room cool, using a humidifier, or offering small sips of water can help alleviate discomfort. In some situations, medications or oxygen therapy may provide relief, but the focus shifts from treatment to comfort. If you notice signs like irregular breathing, cold extremities, or a bluish tint to the skin, take note. These are often signals that the body is conserving energy and circulation is slowing. This is a time to be present, offer reassurance, and create a peaceful atmosphere where your loved one feels safe and cared for. In these final weeks or months, the most meaningful gift you can give isn't medical intervention. It's comfort, dignity, and the reassurance that they are not alone. Final thoughts. As we reach the end of this video, take a moment to reflect on what we've covered. Significant weight loss, extreme fatigue, cognitive changes, frequent infections, and major shifts in breathing and circulation. These 5 signs often emerge in the year leading up to an elderly person's passing. They may not all appear at once, and they may start subtly, but recognizing them can help you understand what's happening and prepare emotionally. For many families, accepting these changes can be challenging. It's natural to want to resist them. To encourage a loved one to eat more, stay active, or push past exhaustion is a natural response. But sometimes the most important thing we can do is listen to what their body is communicating. Rather than focusing on reversing what cannot be changed, we can prioritize making their remaining time as peaceful, comfortable, and meaningful as possible. Recognizing these signs isn't about fearing death, it's about being prepared for it. When you notice these changes early, you can provide better care, make informed decisions ahead of time, and ensure your loved one's final months are filled with love, dignity, and support. This is a time to treasure moments, share memories, and remind them that they are deeply valued and never alone. If you're seeing these signs in someone close to you, take a deep breath and remember, you are not alone in this journey. Many families have been through this, and while it is never easy, understanding what to expect can help you navigate it with strength, patience, and peace. Thank you for spending time with us today. We'd love to hear your thoughts. Leave a comment below sharing one thing you learned and how you plan to apply it. Your insights mean a lot to us, so don't hesitate to share. Reading your comments gives us encouragement and motivation. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating valuable content to inform and inspire. Thanks for watching, and we look forward to seeing you in the next video.